What is snoring? What causes snoring and how do we stop snoring? Snoring is a common condition characterized by the noisy sound produced during sleep when the flow of air through the mouth and nose is partially blocked. The sound is usually caused by the vibration of the soft tissues in the throat and upper airway. Snoring can vary in intensity, from soft to loud, and it can disrupt the sleep of both the snorer and their bed partner. Once upon a time in the quiet town of Serenityville, there lived a man named Oliver who had a peculiar nighttime companion, his thunderous snoring. Every night, as Oliver nestled into his bed, the peaceful tranquility of the town was shattered by the unmistakable symphony of snores emanating from his bedroom. Oliver's snoring had become the talk of the town. Whenever he passed the streets, neighbours exchanged bemused glances during the day, and local shopkeepers playfully mimicked the sounds, earning laughter from passers-by. However, Oliver himself was oblivious to the nocturnal disturbance he caused. One day, a concerned friend, Emily, decided to address the snoring symphony that echoed through Serenityville each night. She visited Oliver to talk to him about his snoring. Emily.
You know, Oliver, I've been meaning to talk to you about something.
Oliver, looking curious.
Oh, what's on your mind, Emily?
It's about your nightly serenade, the snoring symphony.
Oh, that! Is it really that bad?
Let's just say the town is enjoying a free concert every night.
Well, I had no idea. What's the fuss about?
Oliver, snoring can be a sign of something deeper, and it's affecting your sleep quality too. Ever thought about addressing it?
I haven't. Honestly. What can I do?
I did some research. Snoring is often caused by the vibration of relaxed throat tissues. Changing your sleep position, losing some weight, and a few other things might help.
All right. I'm open to suggestions. What's the plan?
First, try sleeping on your side instead of your back. That alone can make a difference.
Determined to restore tranquility to Serenityville, Oliver embraced Emily's suggestions. He started by changing his sleep position, abandoning his back for the comfort of his side. The first night brought a slight reduction in the snoring symphony, but the town still buzzed with whispers of nocturnal melodies. Undeterred, Oliver embarked on a journey to shed a few pounds. He adopted a healthier lifestyle, incorporating regular exercise and mindful eating into his daily routine. The townspeople noticed the change in Oliver's habits, and the once playful mimicry of snores evolved into cheers of encouragement. As Oliver's waistline slimmed down, so did the volume of his snoring. The nightly serenade became a softer, more melodic hum. The town of Serenityville began to embrace the newfound peace, and Oliver found joy in contributing to the hushed stillness of the night. The townspeople marveled at the transformation. Emily smiled, content with the role she played in bringing about a harmonious change. Serenityville, once known for its nightly snoring symphony, was now a haven of peace, thanks to Oliver's commitment to a healthier sleep routine. Several factors contribute to snoring, and these can vary among individuals. Some common causes include 1. Muscle relaxation. During sleep, the muscles in the throat and tongue relax, which can lead to the narrowing of the airway. 2. Poor sleep position. Sleeping on your back may cause the tongue and soft palate to collapse to the back of the throat, partially obstructing the airway. 3. Excess weight, overweight. Individuals may have extra tissues in the throat that can contribute to snoring. 4. Nasal congestion. If the nasal passages are blocked due to congestion or other issues, airflow can be restricted, leading to snoring. 5. Alcohol and sedatives. The use of alcohol or sedative medications can relax the muscles in the throat, increasing the likelihood of snoring. 6. Age. As people age, the throat muscles tend to become more relaxed, potentially increasing the risk of snoring. To reduce or prevent snoring, you can try the following lifestyle changes and remedies. 1. Change sleep position. Sleeping on your side instead of your back can help prevent the tongue and soft palate from collapsing to the back of the throat. 2. Lose weight. If you are overweight, losing weight may reduce the fatty tissue in the throat and alleviate snoring. 3. Avoid alcohol and sedatives. Limit the consumption of alcohol and sedative medications, especially in the hours leading up to bedtime. 4. Treat nasal congestion. Addressing nasal congestion through methods such as nasal strips, decongestants, or nasal irrigation may help improve airflow. 5. Stay hydrated. Drinking plenty of water can help reduce mucus in the throat and nasal passages. 6. Use a humidifier. Adding moisture to the air with a humidifier can help keep the throat from becoming dry and irritated. 7. Practice good sleep. Hygiene. Establish a regular sleep routine, maintain a comfortable sleep environment, and ensure you get enough quality sleep each night. If snoring persists despite these measures, or if it is accompanied by other symptoms like excessive daytime sleepiness or gasping for breath during sleep, it is important to consult with a healthcare professional. Persistent snoring could be a sign of a more serious condition, such as sleep apnea, which may require medical intervention. Hope you've learnt something new today.